Okay, continue po tayo sa applied channel theory 132, diagnosing via the channels. Okay. Having described the basic tendencies of the channel in the presence of disease, the practitioner is now ready to begin the process of developing skills to observe those tendencies. When palpating the human body, the practitioner is faced with the question of whether what they feel is normal or abnormal. So, kailangan po natin ma-distinguish kung alin po yung normal sa abnormal. Patients are in fact variable, and a wide variety of things will be discerned when one palpates the channel. Moreover, there are types of nodules and fatty deposits that are unrelated to the pathology. So, minsan may nakakapa or napalpate na nodules and fatty deposits, hindi naman related sa pathology. Over time, however, common patterns of irregularity will begin to emerge, and certain types of noticeable change will correspond to suspected organ pathologies. So, kung meron pong pathology or invasion ang patient, over time, magde-develop po siya ng mga changes. In order to distinguish between changes that are significant and those that are not, a certain criteria should be kept in mind. So we have criterias. Changes should generally meet at least two of the following three criteria in order to be considered significant for the purpose of channel diagnosis. So kailangan po natin at least two para ma-consider po na related yung changes dun sa pathology ng patient. First, there should be changes should be in clear line along the specific channel pathway. So kung may ubo sipon, pag-change natin sa lung channel, doon tayo makakahanap ng mga changes. Next, changes should have some connection to the disease symptoms. So yung nakita po nating changes, connected or relevant dun sa pathology or invasion sa katawan ng pasyente. In other words, they should come and go with the ebb and flow of other symptoms. So related po dapat. As noted above, the channel changes may not occur at exactly the same time as other symptoms and may appear before or after. So, pwede po yung sign and symptoms before pa man magkaroon ng changes sa patient, pwede na pong lumabas or pwede ito lumabas after ng condition. For this reason, careful record should be kept about what palpation reveals at each patient visit. So, we should record kung ano po yung na-notice natin, and each visit, i-check po natin kung may changes. Kung may lumabas or yung lumabas nag-improve. So, we need to check and record those changes sa every patient visit. Number 3, changes should be located bilaterally. One side may, however, be significantly more affected than the other, especially in those conditions which are situated more in the channel than in the organs such as pain. So, check po natin left and right, and one side could be affected more than the other. Observe changes like lipoma, neuroma, moles, canker sores, pimples, tinea, and melanin irregularities like freckles that do not meet the above criteria fall outside the scope of channel diagnosis. So, ito pong mga ibang lumabas na hindi naman related, so i-exclude po natin sila sa channel diagnosis. Changes of this type are better considered in the context of dermatology in Chinese medicine. So dun po siya i-consider. Sa 5 method of channel diagnosis, now we consider the types of changes that are considered relevant to channel diagnosis. It is important to note that there are actually 5 categories of classical channel diagnosis, of which the channel palpation is but one. So first, we have yung observation of channel pathway. Yun po, isa yun. Then yung pulse diagnosis, palpation of channel pathways, pressing of points, and feeling the body surface. So lahat po ito dapat ma-observe natin. The first 4 of these 5 methods were mentioned in our discussion in the Inner Classics sa Chapter 3. In the modern clinic, all 5 methods are quite important. So lahat po sila importante. In this context, however, we will focus on relatively underutilized technique of palpation of the channel pathway. Discussion of the first 2 methods can be found on Appendix 4. The other 3 methods are combined below in a general discussion of manual diagnostic techniques. So, tandaan po natin itong 5 methods. So, palpation, pressing the points, and feeling the body surface. Although classical sources distinguish 3 separate techniques of palpating, pressing, and feeling, in actual practice they overlap. These techniques were first introduced in the Inner Classic and discussed further in the Classic of Difficulties. The famous 3 Kingdoms period text, the Systematic Classic, compiled by Yuan Fu Mi between 215 and 282 AD, refines the technique of palpating along the channel and discusses the relationship of channel changes to disease. In Chapter 12, Yuan Fu Mi asserts where there is disrupted movement in the channel, there is a disease. So kung merong changes, there could also be a presence of disease. From this one could go on to say that when the practitioner discerns disrupted movement or change in particular channel, it is somehow involved in the disease at hand. Sa Chapter 14 of our text, however, we will consider the idea that the channel with palpated changes may not actually be the best for treatment. The fact that palpable changes, channel changes can be found is one reason why practitioners of Chinese medicine attach such importance to the simple process of taking one's hand and placing them on the patient to understand the condition of the body. This seemingly obvious prerequisite to a clear understanding of a patient illness is sadly absent from many modern clinics. One often hears about how little physical contact modern physicians have with their patients, but unfortunately, the same is true for modern practitioners of Chinese medicine. So, sabi dito, importante po na ipapalpate, i-check, which is minsan hindi na po nagagawa. To know the condition of the patient channels, one must begin by laying one's hand on the body. So, kailangan ipalpate, i-check natin. Taken together, the 3 manual techniques describe a process of moving along the course of the 12 channels with one hand.